You are watching the Doctalk show.
Welcome back. We are discussing blood clots with our doctor experienced in blood diseases, Dr. Dungu Henry. And just before we went for the break, we got to understand certain factors propagate blood clotting. These will include stagnation of blood. That means when your blood flow within the legs doesn't move quite easily, for example, due to inactivity, or it may be an injury to the blood vessel that can also increase blood clotting, or certain factors that increase the clotting system. So we want to now understand, just to get an idea of how dangerous these blood clots could be. If someone suffers a blood clot, what is their risk? Dr. Dung, how dangerous are these blood clots that we're talking about?
I'm a member of the World Thrombosis Day Committee, and in Africa I'm the only one where we are advocating for awareness of thrombosis.
Thrombosis to mean
clotting.
Blood clotting.
Blood clotting.
Okay.
Especially the general public, to understand that when you get a blood clot, it can be dangerous. And you are the person, you should be able to tell your doctor, doctor, am I at risk of getting a thrombus, a blood clot, especially if I'm in hospital, so that the doctor can make an assessment to see if you're at risk, so that if you're found to be at risk, something is done to prevent it. But that one will come later. When a person has a blood clot, for example in the leg, it will swell, it will become uncomfortable, it will become painful. If this blood clot is not identified and diagnosed or confirmed and given the right treatment, it can cause local damage where it has formed. I told you that we have valves in the veins. If you have it in the vein, it can cause damage to that leg, which might actually be permanent or long-term. But the most feared complication is when this clot is a thick, jelly-like material, moves from the veins, continues to the heart, and drops into the lungs. When it drops into the lungs, we call that a pulmonary embolism. A pulmonary embolism can be extremely dangerous. There's so many people who never live to tell that story because they complain of chest pain, they collapse, they're gone.
Because usually within that's if it's a very big clot. Yes. Within the first 1 to 2 hours, they lose their lives.
If you don't get a big one and get a small one, it might drop into the small vessels within the lungs, and one can present with chest pain, difficulty in breathing, and again, if you don't get urgent attention, you might get 2 complications, either short-term or long-term. So the other feared complication is a long-term complication we call post-thrombosis phlebitis, which means after the clot, you're going to get chronic irritation of the vessels that were affected. It will present with excessive swelling of the leg. You know, someone wakes up in the morning with a small leg. In the evening, they have a big leg associated with itching, with darkening of the skin, and sometimes formation of wounds. And once the wound forms,
and they may also feel some pain in the legs.
A lot of discomfort. Some people tell you that actually that complication is more uncomfortable compared to the clot itself. And of course, if you've had a blood clot and you continue getting this, you'll think you still have the clot that you had, but actually when it's a complication.
So the clot kind of disappeared, but it's the blood vessel which is continuously
It has become
irritated.
so redundant. Each time you stand, drop falls back, blood falls back. And this blood has no nutrition because it is deoxygenated. So you end up having blood pooling, but it does not have the nutrition, so the tissues end up dying, and you get that. Now, if you have a clot that has formed in the arteries, it can give someone a stroke, because remember, the arteries are the ones that are sending good blood.
The
rest
blood
of the
with
body.
oxygen coming from the heart to
So-
the bodies.
If you have a clot forming in the arteries that supply the brain, you're going to present with a stroke. If you have a clot, an artery, for example, of the leg, and it gets a clot in there. For example, someone has risk factors for clotting in there, and I know you talk about risk factors. You are going to find that the entire leg has no food. The entire leg is going to die off because there's no blood flowing.
Because the clot has blocked
The main
the blood
source of
supply. Okay. So it's a very, very severe disease that people should be aware about, and they should take it more seriously, which may bring us to the next question. Who is at risk of getting these blood clots if it's this dangerous? Are there particular groups of people who might be at a higher
Yeah, there are
risk?
particular people who might be at risk. And again, we're going to look at the three factors. That if you are in a situation of lack of movement or stasis, if you have an injury to the vessel, or you have clotting factors that make it more for you to clot, or situations that make your factors clot faster than they should, you can have that. The risk factor you start with is age. Clots are more common among people who are older than maybe 50 years or 45 years, but you can get them even earlier.
Okay.
If you're pregnant, your chance of getting a clot increases compared to the one who is not pregnant. And then people who are born with factors that make them clot more. Technically, we call that thrombophilia, where you have either lack of factors that stop you from clotting, or you have an excess of clotting factors. And then we have medical conditions that can predispose you to blood clots. For example, if someone is involved in an accident, they get admitted to a hospital. For example, they have a fracture of the upper limb.
And many people get accidents from
There's so many.
border borders or from motor vehicle accidents.
I had wanted to avoid that word, but
So that is
so
a big
many
risk.
people.
So the big risk of blood clots.
Many of these are not dying of the fracture they got. They will die of the complication they got as a result of the fracture, either following surgery or before surgery, because you're in one place. Even when you put a cast, that white thing you put on the leg, it increases your risk of getting a blood clot. That's why we need to monitor them. If someone has, for some reasons, a stroke, they get paralysis of one side of the body, they remain in hospital, they are at risk of getting a clot. And then, of course, we have those who smoke. Smoking increases. A person who has active cancer, either undergoing treatment or they have cancer without treatment, they're at high risk of getting a clot or blood clots. And then a number of others. People who are obese, if you have a body weight that is, more than your height, you're at risk of getting blood clots. And we need to watch out on that.
Also, in addition, there are certain drugs or medical products which people use. In particular, the contraceptives. They've been
Hormonal
shown to be,
contraceptives.
yes, they've been shown to be associated with a formation of blood clots. In particular, the estrogen-containing contraceptives. There are some other drugs which are used in the treatments of breast cancer, like tamoxifen, or
Can be associated.
hormone replacement therapies. All those can propagate.
And you see, we don't tell people that you cannot use, say, hormonal contraceptives. When you go to your provider, they are so well trained that they will ask you to see if you're at risk of getting blood clots. And if they find that your risk of getting a clot is high, they'll actually
want to
advise
give
you
it.
on taking something else.
Okay. So at least they do some sort of assessment.
Yeah.
And they see if you have some factor that might increase the likelihood of getting blood clots, they won't give
And the beauty
the
is
COCs. Yes.
the current hormones that we have for contraception, they have very little amounts of estrogen. All these were adjusted following, discoveries that if you give an excess of this, you're at risk. So people should not stop using contraception, but they should be monitored. And before they take on the service, they should be advised on which other options.
So after the break, we'll come and now understand how we can identify that you might be getting a blood clot and what measures you can take to prevent yourself, whether to prevent the clot from progressing or to protect someone who doesn't have the clot from getting a clot.
You are watching the Doctalk Show.